Okay, the other question I have here for me is the KRAS seems to have had a lot of advancement for treatment lately. I touched on some of them. Is there any more information that could help a patient that has a designated KRAS mutation to make sure to get the best chance for the best treatment? So I think it's a really good question because we do have an FDA drug available right now. So you can certainly go on sotorasib and have your oncologist prescribe the sotorasib. But the main challenge with KRAS mutation, as I mentioned, is just it's not as good as the others. And I think, honestly, in my opinion, the best chance you could have is to participate in a clinical trial where you can see a combination of KRAS given with other agents. And all the major academic institutions right now will have either one or a different KRAS drug. And if you treat it by an oncologist in the community, just ask them what is the academic partner that they work with, and ask them to be referred to a clinical trial to an academic partner. You can actually look for clinical trials yourself at clinicaltrials.gov, and you just enter the KRAS mutation, and you'll see what comes up. It's a bit of a daunting task because clinicaltrials.gov is not a patient-friendly, interface. But at least you can also have your oncologist help you look at the clinicaltrial.gov and look for the mutations.
Yeah, and Luda, I'll also mention on the topic of clinical trials, the next generation sequencing reports, depending on the platform that's being used. So like Foundation Medicine, for example, when they send the results out, usually they'll indicate what the mutations are that are present in that patient's tumor sample. And then if there's an FDA-approved therapy, and if there are ongoing trials, and so I think that that's actually quite useful. And that's as a patient, that's your information, and you should get a copy of that, and so that you can really look and understand what are the mutations that were detected, and what are the options available, and certainly talk to your care team about that.